Well, warm welcome to today's talk. It's Thursday, the 2nd of September. Now, in the short time we have together, most days we manage to get one of these done. It's very difficult for me to try and work out what the most important thing to tell you is. But I think the piece of information I'm about to show you here is probably the most important thing I want to tell you at the moment. Now, I'm going to go into this in more detail later on, but basically what this is showing is that these here, this is the risk with the Pfizer vaccine. This is the risk of a particular side effect with the Oxford vaccine, and this is the risk if you actually get the infection. So infection risk, if you get the infection, if you get the infection there, if you get the infection there, big error bars, infection there, infection there, infection there. So what we see, and we will, if you want to stick around, we will be unpacking this in a bit more detail. But what we see is that if you get the infection, the risk of that specific side effect with the infection is always a lot greater than with either of the vaccines. And this has changed. The reason that I think this is important at the moment is from what we were looking at the other day, and we got actually quite a few comments and a lot of views on that, where we talked about the important announcement that experts in the UK are basically saying that this is going to be endemic for a period of time and everyone's going to get it. Everyone's going to be exposed. Now, if that's true, that means that this risk here, this relative risk, is going to apply to everyone. So here we see the risk of venous thromboembolism, for example, is 8 times higher if you have the infection compared to if you have one of the vaccines, whether it's the Pfizer or the Oxford. So for just that single side effect, the infection is going to give you a much greater chance of getting that. Now, in the past, of course, you might say, well, I'm not going to get the infection. I'll probably be all right. But now we think everyone's going to get it. So this has really changed the dynamic quite dramatically, really quite dramatically, in favour of the vaccines being safer than the risk of the particular side effect with the infection, as well as the many other side effects of the illness as well, of course. So let's just look at that in a bit of detail now. Now, evidence for this. I'm going to be looking at 3 main pieces of evidence this morning. This is the first one. So this is from the British Medical Journal. Risk of thrombocytopenia and thromboembolism, so the low platelets and the blood clots, after COVID-19 vaccine and SARS coronavirus 2 positive testing. Self-controlled case series study. So that is that one, and it's all done in great detail. That's the graphics that we were just looking at there, and we'll look at again in more detail. And the whole text is there. It's great that these are available free. You don't have to subscribe to the journal, so that's all there. Now, the other evidence I want to look at today, this comes from the FDA that we looked at before on the side effects of messenger RNA vaccines, and that's a report from the CDC that we've also looked at before. So obviously the links for all of those pieces of evidence are included in the description, as they always are, because don't take my word for anything, always check the original source. All I do is give you my best understanding of it. Now, first of all, this study is from UK, then this is from England, data's taken from England, and that's that paper we looked at from the British Medical Journal. That's the link for it there. That's the popular description of it there. Professor Julia Hippisley-Cox, leading professor in this field. Now, people vaccinated with first doses. Now, it's always frustrating in these studies that you want to say, well, what about the second dose? But a study only tells us what the study tells us. We can't really speculate much outside the study. That's the whole point of being evidence-based. So this is talking about people after the first dose. It only tells us what it tells us. Although the CDC and the FDA data is talking about both doses, as we'll see. So people vaccinated with first dose over 16. Now, in the study, there was 121,633 people who had the first dose of vaccine over the age of 16. So this is basically all the country. So what we've got here is the Oxford research people working with all the Office for National Statistics and the national data. This is not a sample. This is full data. This is for everyone. This is kind of reflects reality. Oxford-AstraZeneca vaccine, chimpanzee, Dino, Oxford vaccine, novel coronavirus 19 vaccine. Over 19.5 million people had that vaccine. 5.5 million people had the Pfizer vaccine, and they were able to compare that with people testing positive 1.75 million people. So this is basically everyone in England who had the first dose or tested positive. Now, what they looked at was within the data was taken within 28 days of three possibilities, three exposures. So the first possible exposure here was the first dose of the Oxford vaccine. The second thing that they looked at was people who had the first dose of the Pfizer messenger RNA vaccine. And the third thing they looked at was the people who'd had positive tests. So they ended up with three groups, which researchers usually like to do, so they can compare and contrast groups. So we had those three groupings, but in very large numbers. Now, the results. For every 10 million people vaccinated with the AstraZeneca vaccine, an extra 117 will be hospitalised or die with thrombocytopenia. Now, I know not many of these died, but you want to know what the difference is, but it doesn't tell us. This is just what we know, hospitalised or died. My understanding is that there's only been a few deaths, but the data is not released there. So that gives us one chance in 93,459. But the point is that's 9 times lower. The risk there is 9 times lower than the risk following an infection. So these people here in this group got way more thrombocytopenia than the people who'd had either vaccine. So 9 times greater risk in the unvaccinated people who were infected. And if you haven't been vaccinated, you can't really sit there saying, well, I probably won't be infected, because the understanding from the UK experts now is everyone is going to be infected. So that's your risk. So do you want to reduce your risk by a factor of 9? Yeah, of course. That's what that data means to me. An extra 66 will be hospitalised or die from blood clots in the veins. That risk is 1 in 151,000, but that's 200 times, nearly 200 times lower than the risk following infection. In other words, blood clots in the veins are very common, or well, they are common after the infection itself. So again, reducing your risk by 200 times there for that particular pathology, that particular complication of vaccine or complication of disease, but the risk's nearly 200 times greater if you be exposed to the disease. And as we say, everyone we believe now is going to be exposed to the disease in the UK and probably the United States, whether you've been vaccinated or not. So these are the kind of risks that we're talking about. Now, that gives a combined risks for the Oxford-AstraZeneca vaccine of that's 173. So what I did there was I added up that 107, added up that 66, 163, divided that by 10 million, and that gives us 1 in 57,803 of something going wrong after the first dose of the vaccine. But as we see, that is way, way, way better odds than getting the infection itself. So have I personally already been exposed to the infection? I don't know. I haven't had the antibody tests. Could have been, but if not, I'm expecting to be, because this is going to be endemic for a period of time. I'm hoping only for a few seasons, but we simply don't know that yet. But that's a separate debate. Now, the Pfizer vaccine, for every 10 million people with a Pfizer vaccinated with a Pfizer vaccine, an extra 143, just with the first dose, of course, an extra 143 extra strokes would be seen. That's 1 in 69,930. But that is 12 times lower than the risk following an infection. So, if we compare the overall risk there from stroke from the Pfizer vaccine and the overall risk of anything going wrong from the Oxford vaccine, we're not looking at very big differences, really. The Oxford vaccine's had a bit of a bad press. In the UK, it was used first, so the side effects of that became evident first. But here we see those risks with the Pfizer vaccine. So moving on to the other well-known risk, the myocarditis after the Pfizer vaccine. Now, unfortunately, this Oxford study doesn't give us information on that, I don't think. It talks about myocardial infarction, but not myocarditis. So again, each study only tells us what each study tells us. So we'll come back to that in a minute, because I want to unpick that a bit more from the Oxford data. But this was data we looked at from the FDA and the CDC, myocarditis and pericarditis after messenger RNA vaccination in the United States. So this is USA data now. But as we've seen, the consistency actually of the final data when it's analysed by the FDA, CDC and the UK authorities is actually really quite similar. We've got basically similar people groupings getting the same vaccine with the same benefits and the same adverse effects as a general principle. So this is myocarditis or heart inflammation after messenger RNA vaccines. That was the Moderna vaccine and the Pfizer vaccine in the United States. Now, risks. The clinical features here, if this heart inflammation does occur after the mRNA vaccines: chest pain, shortness of breath, feeling of having a fast beating heart, fluttering or pounding heart are the main things to look out for. Now, the data here, that's the FDA data there, that's the CDC data there that we showed where we got our evidence from. 52 million doses were given to 12 to 29-year-olds. 52 million doses of vaccine. There was 1,226 reports of myocarditis after messenger RNA vaccine. And that gives you 1 in 42,414. So that is the risk there. So we see there that the risk in this age group was actually better, was actually a greater risk than the overall risk for the combined thrombocytopenia and thrombosis after the Oxford-AstraZeneca vaccine, which remember was 1 in 57,803. So I really think, and I haven't seen this, I really think there should be a thorough piece of work done by the FDA, CDC, the authorities in the UK, analysing the difference between the Oxford-AstraZeneca vaccine and the Pfizer or the Moderna vaccine, particularly in young men. My question for these bodies is, would young men be statistically safer getting the Oxford-AstraZeneca vaccine than a messenger RNA vaccine? And I haven't seen that anywhere. They've tended to clump the sexes together, whereas we know that the adenovirus vector vaccines, like the Oxford vaccine, are more likely to produce this side effect in younger women. So would younger men be safer getting a non-mRNA vaccine? I would like to see some official data on that, but I actually haven't seen a comparison on that. It may be there, and I've been looking for it, but I haven't found it. So anyway, getting back to this, data demonstrates increased risk, particularly within 7 days following the second dose. Remember, this is the US data now after the mRNA vaccines. The observed risk is highest amongst males under the age of 40 years of age compared to females and older males. So would young men be better off getting the adenovirus vector vaccine, such as the Oxford? Good question. I would like to see that officially answered, because the risk from the mRNA vaccines is highest in males 12 through to 17 years of age. So would they be better getting the Janssen, Johnson & Johnson or the Oxford vaccine? I really think that is a question that needs to be answered. But the main thrust of this of this talk today is that the risks of all these specified side effects in England are much less with the vaccines than they are if you actually get the infections, and we believe we're all going to get the infection. So you can basically take your pick. You've got to have one or the other. Basically, your risk is going to be on one of these coloured lines. You've got to have one or the other. To opt out of this pandemic is not possible, according to the latest thinking. That does actually make a lot of sense to me, and well, I've got it from UK experts, but it also makes perfect sense. So basically, you've got to choose one of these lines. Which one do you want to choose? Is the way I understand this now. Now, of course, I'd like to see antiviral drugs being used more, but we're not using them extensively. So basically, the vaccine is the tool we've got to reduce our risk de facto in the United States and the UK, for example. So basically, this is what we have to go with. So here we have it. So thrombocytopenia, the lack of the platelets, the clotting small red cell fragments, not red cell fragments, so they're actually megakaryocyte fragments from bone marrow cells. But these are the sticky bits in the blood that generate the blood clotting. So Pfizer vaccine risk in the 28 days, Oxford vaccine risk if you get the disease. So we can see if you get the disease, you're like 2.5 times more likely than some other healthy person who's not had the disease and not been vaccinated to get thrombocytopenia. Whereas with the vaccine, you're about your risks increase there by about 25% and your risk increase there by about 10%. Venous thromboembolism after the Pfizer, after the Oxford, but if you actually get the disease, you're 8 times more likely than an equivalent number of healthy people who have not been vaccinated or who have not had the disease of getting venous thromboembolism, a blood clot in a vein. A blood clot in an artery, well, again, we see Pfizer, Oxford, and the risk if you get the disease there. So much greater if you get the disease. Cerebral venous sinus thrombosis, the blood clots in the veins that drain the brain. Well, again, we see the risk there with the Pfizer, the risk there with the Oxford, and the risk if you have not been vaccinated but you get the disease. Now, there are long error bars on this, but we can assume that they're probably pretty close to that risk there. So like getting on for 7.5, 8 times the likelihood of getting a cerebral venous sinus thrombosis if you actually had the infection. Ischemic stroke, Oxford, Pfizer risk slightly greater there if you actually have the disease, more than twice as likely than an equivalent healthy population who doesn't have the vaccine and doesn't have the disease to get the ischemic stroke. Myocardial infarction. Now, this is not the myocarditis. This myocardial infarction is a blood clot that blocks off the blood supply to the heart muscle. The myocarditis is the inflammation of the heart muscle. It's 2 separate conditions, just happen to both affect the heart muscle, the myocardium. So risk of myocardial infarction there after the Pfizer vaccine, after the Oxford vaccine, but after the disease, 2.5, 3 times more likely if you get the infection to have a myocardial infarction in the first 28 days. Other rare arterial thrombotic blood clot events. Well, there we see with the Oxford, there we see with the Pfizer, and there's other blood clot events. Well, 3 times more likely if you get the infection. So that's really quite a powerful graphic that in every case, the risk of these specified side effects that people are worried about with a vaccine, in every case, the risk is higher if you have if you actually have the infection. And given that now we're probably all going to get the infection, basically you've got to choose one of these lines. You can't opt out of this. So do you want to be do you want your risk to be there? Do you want your risk to be there? Do you want your risk to be there? I mean, it's a pretty short debate, really. Blood clots, do you want your risk there, or there? In terms of multiples of getting the disease over a healthy equivalent population. So there we have it. I mean, to me, this is pretty conclusive. I'd love to see this combined with antivirals, but it's not really happening. So this is what we're left with. They're the choices that we have. But I really would appeal to the authorities to do more comparative age and sex related studies between the adenovirus vector vaccines and the messenger RNA vaccines, with my question being, could it be that younger men could be safer getting the adenovirus vector vaccines? I really like them to answer that question and answer it clearly. So that would be good, but there you go. The choice is yours for the relative risk that you have. Life has risks, and I believe this shows us that vaccination minimises the risk of these particular side effects. That's what that data shows. So there we go. Hope that's interesting and helpful. This is the new situation we're in. We are basically entering, or we are now in, the endemic phase. And it's sobering to think that really this analysis, as the Delta variant and other variants that might pop up, Of course, we heard Andrew Pollard just a couple of days ago saying that there might be new variants that are even more transmissible than the Delta variant, which would make it phenomenally transmissible. I mean, if that's the case, it's just so. I mean, here's the information we looked at before on the transmissibility of the virus. So this was spreads faster up here. This was more deadly up here, and we saw that SARS coronavirus 2 Delta variant is as transmissible as chickenpox. More transmissible than smallpox, more transmissible than polio, more transmissible than Spanish flu, than Ebola, than bird flu, than MERS, than seasonal flu. The only disease really on this list that's more transmissible is measles, which is phenomenally transmissible, but more as in the same range of transmissibility ness as chickenpox. So what that means is this applies to everyone in the world. Those risks apply to everyone in the world. So another reason to make sure that people are vaccinated globally as well. Quite massive implications. You know, the last couple of days I've just been letting these implications settle in of the fact that it looks like now everyone is going to get this virus. Everyone's going to be exposed, and the implications of that. Okay, so that is us for today. Thank you for watching.